If a young girl is menstruating, the individual tells you, I'm not clean, and you're like, oh, what makes you feel you are not clean? And she's like, I'm menstruating. It's like I'm supposed to stay back at home. I'm not even supposed to go to church. I'm not supposed to mingle that much. So I think that flows from a culture that menstruation is seen as something unclean for the women, and so you need to be purified before moving to the next level of life. But I've had the opportunity to equally engage people. In fact, as we speak, I had a friend of mine whom I called on Saturday evening, just checking up, and she said, well, I won't be at church tomorrow. And I said, oh, are you sick? She said, well, I'm menstruating. And instinctively, I had to encourage her that menstruation should not stop you from coming to church. Menstruation should not stop you from mingling, from having your social life. It's just an aspect of you being a woman.
Especially in countries in West Africa, that in anything around menstruation, anything around your reproductive health is something that is more like hush-hush. Nobody talks about it. Even your mom, your dad, this age-appropriate sex education is not something that is not something that is rampant, because everybody expects that you should know what to do. So you more like you grew up as a young person or a young girl, and the first time you are being introduced to your reproductive health is maybe your first menstruation, and sometimes you are confused, like, why is it that blood is coming out from my body? Because you are not being prepared.
Girls that are going to school, most times they don't know how to change their pads or which type of sanitary pads they should use, which is good. Sometimes I can still recall in a community where we went on outreach, a girl is still using a used cloth. They fold it for a pad, which is not healthy. It can infect the person if it's not taken care of. One person can use one pad for probably the rest of the day instead of changing it. So the educational part of this menstruation thing, I don't think it's kind of like talked about to the way I want it to be talked about, because every girl has the right, because this is an important part of the human, especially for the women, because with the menstrual cycle, if it's good, you don't have any infection, then you have the opportunity to bear children if you want to. But if because of an infection it affects your reproductive health, then I don't think it's kind of like a good thing.
So it's really something that is being stigmatized in countries in West Africa, and people are not really it's not being talked about enough, because I remember even while growing up as a young girl, anytime you are on your period, you are kind of super careful, so that there will be no stain or anything, so that people don't laugh at you.
As a woman, if you don't see your menstrual cycle, definitely the potential to give a birth is not there, it's not possible. But by seeing your menstrual cycle will also tell you that you are matured. You are now a matured woman, and you can get pregnant at any time you get sexual intercourse. So because of that, we also educate the girls, especially the girls we are working with in the schools. Because at first, it was forbidden to tell children, especially girls, about menstrual cycle when they are not yet in their menstrual stage. But if you don't tell them, there will be a problem. Because when that time reach, when they start seeing their menstrual cycle, they don't know how to manage it. But if you have already educated them, when that time reach, when they started seeing their period, maybe at the age of 10, at the age of 11, 12, or 13, they will know, oh, our teacher told us that these are the measures, how to take care of it.
We are trying to teach the parents, if you don't talk about this to your children, one way or the other, they will learn it in the streets. So you might as well break that taboo and talk with them. But when it's something deeply rooted, tradition is deeply rooted, you won't get rid of it in 1 or 2 days. It takes years. But we're slowly seeing it that organizations are really going into schools, educating girls about understanding that their menstrual cycle, and understanding that if you get sexually active, that you need to do some prevention in order for you to be prevented from getting pregnant in the first place. It's not a big thing, but it's slowly creeping in and it's slowly making an impact.
So knowing your cycle is very, very key, because that tells you when you are not pregnant. Because according to pregnancy, if you get pregnant, you are not supposed to see your menses anymore, except for any other abnormalities. Yeah. So taking care of yourself during menstrual period, that guides you also how to take care of your pregnancy. Because what you have been taught before you get your menses, and now what they are going to teach you again about pregnancy, you put them into practice because you have already started it earlier during menstrual cycle. So whatever they taught you, you put them into action. Pregnancy needs to be by choice, not by chance. So if you get your pregnancy by choice, you'll be able to take care of it and manage it well.
Also, the culture behind it is that this is a mentality we're trying to change. When you get pregnant as a student, you drop out, that's the end of your educational progress. And it's wrong. We know that it's wrong. I mean, it's just a hiccup in your life. So educating our students that this is just a hiccup, it shouldn't interrupt your educational progress. But also, it's not only our girls, it's educating our families. The culture behind it is really not encouraging, because that is the mentality that is there. Once you're pregnant as a teenager, you're done. The next is marriage. We as educators, we have to fight that, let's give these girls the opportunity. It's not the end of their education. That's where we encourage our public health students, because you are the public health students, and you are the ones that are going to start working, because you are there in the public, you are educating them about prevention, other diseases, and also, maternal care and child and menstruation is also another thing that you have to educate our people about.
So menstrual equity is really something that's in recent time that has been there has been a lot of advocacy around that area. People are being sensitized about the importance of making sure that girls, when they are in their periods, they are able to go through it in a dignified way.
As a country as a whole, you probably have heard about the First Lady's flagship program, which is the free sanitary pad donation to school-going pupils. This is a very laudable venture, and we think this is also giving girls an opportunity to attend school. Sure, if this is replicated in our communities, that we take responsibility to educate our girls, that we take responsibility in our schools to ensure that we provide the necessary support for our women for our girls during menstruation. I'm sure it will help them a lot to have a better menstrual hygiene and to plan themselves better.
For us, as I'm working for MMW Sierra Leone, as a focal person, we have been working also on this menstrual hygiene. We are even working with the schools where we are dealing with adolescent children, especially girls. We teach them how to make sanitary pad so that they can be able to manage it. Because there are some students who cannot afford a packet of pad now is 20-something thousand, 20 or 30,000. Can you imagine? Some students don't even have long to go to school, and talk less to provide 20 or more to buy a sanitary pad. But because of MMW was providing the material needed so that they can be producing a reusable pad, we are producing it, we are teaching the children so that they can be able to do it. And they are not only doing it for themselves, they are also doing it for their colleagues in the community where they find themselves. For instance, if I know how to make pad, I will make for my sister, I will make for my mother. So because of that, it's also reduced cost.
Education. It's all about education. So for Inspire Hair, when we give our reusable pad, we don't just hand it over. It comes with education. First of all, the product is packaged with all the instruction on it. Wash it before use, do not share, do not iron, a list of all of that. And we don't just give it out, we go there to deliver. So we give them the education, the do's and don'ts, and we encourage, so we do it in addition to the menstrual health education. Because believe me, if women have poor menstrual hygiene practices, it doesn't matter whether they use disposable or reusable. If they don't change pads every 4 to 6 hours, if they are not washing with adequate water, if they are not maintaining proper hygiene, the odds are the same, whether disposable or reusable. So education is really key, and we drive it down. We also, what we do innovatively is to translate the educational materials. You know, a lot of people don't understand this English and all these things we are saying. So we go to the local communities and we speak their local language. We call the menstruation by the names that they are comfortable with. We educate them. This is how to do it. This is how not to do it. We share experiences, and we even train local leaders, especially school teachers and queen mothers, to be champions of menstrual health in these communities, to ensure that they do not introduce any further risks, but they are supported to use it. We also do advocacy on water, because reusable has to do with water, and most rural areas do not have access to clean water. So that's why now menstrual equity sits in the larger water and sanitation and hygiene agenda, to ensure that we are providing these communities with water, safe drinking water, and then they can wash their pads and use that. It's a long way, it's not perfect, but we are making headway, and we believe that with all the benefits, even the eco-friendliness of the reusable pad and all of that, actually will go a long way to help women and girls.
And we are not leaving the boys behind, because sometimes we assume that it is a girl's issue. That is where culture and tradition have shifted that mind, and where men do not even understand what their daughters are going through. They do not even understand what their spouses are going through. So we encourage the boys too. And some of the boys now, surprisingly, they are stitching pads for their sisters. Girls should be provided with the education they need. Girls should be provided with proper sanitation. Girls should know how to look after themselves. Sexuality education should be in schools. And also, the environment should be friendly for them.